obligating funding that Congress appropriated. We appropriated, it is the law of the land for NIH research, and to obligate those funds by September 30th of this year. Or are you planning to break the law by impounding congressionally appropriated funds?
If you appropriate me the funds, I'm going to spend them.
We have. In the bill, you are cutting the NIH by $18 billion, or you're proposing to cut it by $20 billion. The Congress appropriated those funds. It passed into law. It's part of the 2024 budget, and we are under a continuing resolution that has adopted the 2024 numbers. How then can you justify cutting $20 billion from the biomedical research budget?
Folks, I just watched a heated exchange between Congresswoman Rosa DeLauro and Secretary RFK Jr. And let me tell you, this wasn't just political theater. This was a full-blown clash over public health, government transparency, and our taxpayer dollars. Let's break this down because it's important we understand what's really going on here, as Americans, as voters, and as people who expect their government to follow the law and serve the people.
The ranking member, Ms. DeLauro.
Thank you very much, Mr. Chairman. Let me just one area of correction, which has to do with the measles issue, Mr. Secretary. You keep comparing the U.S. to other countries. You compare us to Europe, but the Europe you are referring to is the WHO European region. That's 53 countries in Europe and in Asia, including those with low vaccination rates like Romania, that has never eliminated measles. If you compare us to Western Europe countries that we often compare ourselves to, like Great Britain, they have seen no measles death this year. Let me move to the NIH. In your testimony, you say you want to quote, and I quote, rescale our biomedical research budget, unquote. Excuse me, but that's BS. You are not rescaling NIH research. You are proposing to cut it by $20 billion. And according to our colleagues in the Senate, NIH has effectively cut research funding by $2.7 billion this year in comparison to the same period last year. That's a cut of 35% during that period. That includes cutting cancer research by 31%. This is the report put out by the Senate, Trump's War on Science, which goes into detail about how we are, in fact, dealing with cutting scientific research. Mr. Secretary, are you freezing or withholding funding that Congress appropriated in 2025 for life-saving NIH research?
Let me address your first issue first, because I want to correct you. We have about 1,100 measles cases in this country. The growth rate last year was 15 additional, so we have plateaued. Mexico has roughly the same number with a third of our population, and they got 300 extra cases last week. Canada has more measles, 1,500. They have 1/8 of our population. Western Europe has about 6,000, which is 10 times the number that we have. Well, you are wrong about what you said earlier.
We can discuss that, but I think one has to consider whether or not we're dealing with decades of data proving how effective and safe the measles vaccine is. I want to move to that. I want my questions answered on, are you freezing and withholding funding that Congress appropriated in 2025 for life-saving NIH research?
We are not withholding any funding for life-saving research.
Okay. Do you commit to following the law?
Of course.
Fully obligating funding that Congress appropriated. We appropriated, it is the law of the land for NIH research, and to obligate those funds by September 30th of this year. Or are you planning to break the law by impounding congressionally appropriated funds?
If you appropriate me the funds, I'm going to spend them.
We have. In the bill, you are cutting the NIH by $18 billion, or you're proposing to cut it by $20 billion. The Congress appropriated those funds. It passed into law. It's part of the 2024 budget, and we are under a continuing resolution that has adopted the 2024 numbers. How then can you justify cutting $20 billion from the biomedical research budget?
If you appropriate the money to me, I'm going to spend that money.
We have appropriated, Mr. Secretary.
Then I'm going to spend it.
Then you're going to spend it. You're not going to cut $20 billion from the NIH.
The White House proposal is to do very, very large cuts at NIH.
Well, that is contrary to
but
the
if-
money
if Congress-
appropriated.
Ranking member,
Yes.
if Congress appropriates me the money, I'm going to spend the money. You have the power of the purse here.
Thank
sure
you.
know that.
Thank you for reiterating that. But I think that I'm not sure the administration really has internalized that. Particularly, Mr. Vogt hasn't internalized that when he says that we can in fact impound money. The money is there. The 2024 budget includes the funding for the NIH. Will you commit to spending the money that is in 2024 in that budget?
As I said, ranking member, if you appropriate the money, I'm going to spend that money.
The money has been appropriated. So the answer to that is if you're not willing to accept the funds that have been lawfully voted by members of the House and Senate on the money for the National Institutes of Health. Well, I'm going to hold you to your word that that funding is there. It should be transferred from 24 to 25, and you've cut already $20 billion. Let's get that money back. Let's get that money back. You have an obligation to carry out the law and to implement what the Congress has done. Unbelievable. Unbelievable. Chronic disease and tobacco. Tobacco use is a major contributor to chronic disease and is a leading preventable cause of death in our nation. Each year, killing nearly 500,000 Americans, costing the nation nearly $250 billion in healthcare costs. CDC's tips from former smokers media campaign alone is estimated to have saved more than $7 billion in healthcare costs by helping more than 1 million smokers quit. Why did you eliminate CDC's Office of Smoking and Health, an office that reduces the number of kids using tobacco products, helps order tobacco users to quit, and saves taxpayers dollars?
We have, under the reorganization, and I'm going to talk very, very broadly, because as of 4 o'clock yesterday afternoon, we are under a court order not to do any further planning on the reorganization. And I've been advised by my attorneys and not to talk about it. But I will just say broadly, many of the programs that the Democrats are now saying were cut at CDC were not cut at all. Those programs were transferred to the Administration for Healthy America. But I'm not permitted to talk in any more detail because of a court order.
I know we're just dealing with words. You transfer it here, there's less money overall for the agency, therefore there's less money for the programs. In both 2024, 2025, Congress, again, power of the purse resides here, appropriated $246 million for CDC's tobacco prevention programs. Do you commit to following the law again, fully obligating those funds so that we can help adults who want to quit using tobacco and prevent teens from becoming addicted?
Allow me to answer that by pointing out the absolute cataclysmic disorganization of this agency under your oversight for 40 years. We had 9 separate offices of women's health. When we consolidate them, the Democrats say we're eliminating them. We're not. We're still appropriating the $3.7 billion, but we're not keeping all 9. We had 8 separate offices for minority health. We eliminated 1. We had 27 HIV offices.
Okay, let me just, I'm going to
We had 59 behavioral health
right.
programs.
I'm well over time. If you could just get us what has been eliminated, why you're doing it, and the criteria by which the elimination has occurred. That is information that this committee needs in order to be able to do our job in terms of appropriating funds. Thank you.
And we will gladly provide that to you, but right now we're under a court order that prohibits us from doing so.
Okay.
So first off, DeLauro slams RFK Jr. for comparing U.S. measles stats to countries like Romania and Mexico. Instead of countries we actually should be comparing ourselves to, like the UK or Germany. And I agree with her here. When you play with the numbers, you're playing with lives. Let's be straight. Public health isn't about spin. It's about truth. Now here's where it gets really serious. DeLauro calls out what the secretary calls a risk scaling of NIH, but it's not risk scaling. It's a $20 billion cut. Cancer research, down by over 30%. Folks, this is life and death stuff. When my family pays taxes, I expect some of that to go toward cures, not cuts. DeLauro goes in hard asking if RFK Jr. is planning to impound funds that Congress already appropriated. And listen, as a proud American, this sets off alarm bells. Congress has the power of the purse. If executive agencies start ignoring that, what kind of democracy do we really have? She's right to point out the contradiction. You can't say you support science while gutting its funding. That's like saying you love your car while siphoning gas out of the tank. NIH isn't a luxury, it's a necessity. She also grilled RFK Jr. on eliminating the CDC's Office of Smoking and Health, the same office that has helped millions of Americans quit smoking. Why kill a program that literally saves lives and money? Makes no sense unless you're playing politics instead of doing your job. Now, RFK Jr. says the cuts aren't really cuts, just transfers under a reorganization. But here's the problem. He admits he can't even talk about it due to a court order. Sorry, but when our health is on the line, I don't want legal silence, I want answers. To be fair, RFK Jr. does point out that the agency had dozens of overlapping offices, women's health, minority health, HIV, all spread out in a tangled mess. And honestly, streamlining isn't a bad idea if it's done transparently and keeps services intact. But so far, we're not seeing that transparency. Let me be crystal clear. If Congress passed a law and that money is in the budget, it must be spent as intended. No tricks, no delays, no hiding behind legalese. If that money is meant to save lives, then we better be spending it on saving lives. DeLauro ends by demanding documentation. What was cut, why it was cut, and who made those decisions. And that's exactly what we should all be demanding. Because in this country, the people deserve to know how their dollars are being used. Look, love, or hate either of them. This hearing showed the cracks in our system. Whether it's measles outbreaks, cancer research, or tobacco prevention, our government owes us facts, honesty, and action. No one is above the law, not even the Secretary of Health. As a patriot, I want healthcare driven by science, not politics. I want budgets that heal, not cut. And I want leaders who answer tough questions, not dodge them. If you agree, hit that like button, subscribe, and share this video. And drop a comment below. What do you think about the NIH cuts and this fight over public health funding? Until next time, stay informed, stay patriotic, and demand accountability.